Hi, I'm Dr. Isabel Ryan, and I want to chat with you a little bit about fertility preservation. So with the advancement of technologies in IVF labs, fertility preservation is definitely a viable option for patients. And this is applicable both for patients who are single or patients who are partnered, because we can talk either about freezing eggs or freezing embryos. And even though one is partnered, some patients still choose to freeze eggs versus embryos. So it's not as if one category links you to one of these options. So fertility preservation is an important option for patients who want to delay childbearing or who want to delay family building, but who also want to have optimal chances at the time that they actually want to get pregnant. So they're understanding that now's the time to take tissue that may be healthier and more viable, meaning eggs and sperm, and then freezing those to then be able to use them in the future. And this is especially relevant if you want to have a family of more than one child, because it may turn out that depending on when you start trying to conceive, that it may be easy for you to conceive your first child, but conceiving your second child may have more of an issue, and it is at that time that you may be quite happy to have either frozen eggs or frozen embryos to work with. One of the myths is that freezing eggs is less effective than freezing embryos, and I am definitely going to burst that myth right now. So if you take an embryo that's created from a frozen thawed egg versus an embryo that's created with a fresh egg, both of these embryos are going to have the same chance of yielding a pregnancy. The only difference is that creating your embryos right away from those fresh eggs is slightly more efficient, because when you freeze eggs, there's a 15% loss rate on average. Whereas if you had used those eggs fresh to create embryos, then you wouldn't have incurred that loss. But for most patients, losing 15% of their eggs is a okay trade-off, because of the eggs that then thaw, most of them are going to have a very good chance at yielding an embryo down the line. The process that you yourself as a patient will go through, whether you're freezing eggs or freezing embryos, is going to be exactly the same, meaning you will undergo the same process of doing the stimulation injections, having your eggs grow, us gathering those eggs through a retrieval process. The only difference is going to be what the lab is going to do for you. So are they going to take those eggs and freeze them right away? Or are they going to take those eggs and mix them with your designated sperm source, grow your embryos, and then most people biopsy their embryos to do chromosome testing as a pre-selection screen, and then after that your embryos are frozen. So if you want to discuss any of these options, you should definitely seek a consultation with your fertility physician and decide if fertility preservation is right for you, either freezing eggs or freezing embryos.